Hello, I'm Paul Peterson. Thanks to advancements in health promotion, disease prevention, and medications, older adults are living longer and more actively than ever. Medication-related problems are not uncommon, though, and can cause, aggravate, and contribute to some common and costly health problems. Today, we'll be discussing this with experts from the USC School of Pharmacy. Stay tuned for Aging in LA. Older adults age 65 and over will soon comprise more than 20% of the U.S. population and consume more than 50% of the prescription medications dispensed annually. To meet the needs of this growing population, the University of Southern California School of Pharmacy has been pioneering in its development of geriatric pharmacy practice, and they're renowned for their work in addressing senior needs. Today, we'll be having an interesting discussion with Dr. Stephen Chen, Associate Professor of Clinical Pharmacy and Pharmacological Economics and Policy, and Dr. Bradley Williams, Professor of Clinical Pharmacy and Clinical Gerontology. These outstanding faculty members of the USC School of Pharmacy will help us understand the need for good medication management. Thanks to you both for joining us. You know, I'm so proud that USC is right here in our own backyard and has a school as distinguished as your School of Pharmacy. Welcome to you both. This whole area is not only a large and significant part of healthcare costs, but it is of great concern to those of us who are caregivers. Let me start with you, Stephen. How are you treating this growing population, the needs of the growing population? Can you give us an idea of what you're doing in your work?
Well, my primary job at USC in terms of direct patient care is working with chronic disease management. And I think, as we know, as our senior population grows, they're becoming the predominant population in diabetes, and high blood pressure, and so on.
Yes.
And so we have developed pharmacist-run disease management programs in various clinics throughout Los Angeles, where physicians send to us their most complicated, their most difficult to treat patients with these chronic illnesses.
You mean doctors don't know everything?
I respect so much the work of physicians. They are so overburdened, as you already know.
Yes.
We don't have enough primary care physicians out there. They're struggling to see patients in 5 or 10 minutes. It's impossible for them to manage drug therapy, to identify the best treatment options out there, to train patients to be better at managing themselves. So that's where we come in. We come in with pharmacists that are specifically trained to work with diabetes, to work with hypertension, to know which drugs are out there that are available, that will work well for that particular patient, and make sure that all medications are affordable and accessible.
That's so important. And a lot of your work is face-to-face. I mean, in addition to teaching the next crop of pharmacists that we're going to have, you are actually seeing people face-to-face.
Absolutely. As much as possible. It's really the best way to make an effective impact on a patient is the face-to-face encounter. And I think we brought up something earlier, the fact that we don't have enough physicians or pharmacists out there to meet the needs of all the seniors. And so we are developing some programs that are remote, where we talk by phone or other means to patients in order to reach out to all those that need help.
You know, it's so interesting to me. We've had words before this program began, of course, but one of the things that you mentioned was this brown bag program, where you can actually bring into an educated pharmacist your medication menu, if you will, and say, am I doing this right? Is that right?
That's right. It's something that's very valuable, because people can bring everything that they take, including their non-prescription medicines, their dietary supplements, if they're taking any herbal products, and it gives the pharmacist an opportunity to review them right while they're there, go through item by item, find out if the person really knows why they're taking them, what to expect from them, both in terms of benefit as well as adverse effects. Evaluate them for interactions with any of their other medicines, with their diet, and just get a really good sense for, is everything okay or not, and then provide them with some advice that they can take home with them to help manage their medications better.
Well, and you would see a caregiver as well, right? I mean, if someone has a concern, gee, I think mom has taken too many things, that's a good person
Absolutely.
to educate.
And in fact, we really prefer for all of our older patients, you know, unless they're those who are taking no or one or two medicines, to have a second set of eyes.
Right.
Just because it helps further reduce the risk that something's going to go wrong.
Well, is this correct that we have really learned that there are many drug interactions that were unknown just a few years ago, and now we're suddenly seeing that, wait a second, there are some contraindications here with medications that may be by prescription dispensed to seniors?
Certainly there are a lot of interactions that have been recognized, and I think it frightens a lot of people. Frightens physicians, frightens patients, because it's hard to predict beforehand if they're actually going to experience that or not. So some people are afraid that they're going to have interactions and they won't take their medicines, or they'll take them and not recognize the interactions.
Oh boy, and especially with older adults who may be suffering with first signs of dementia, or they're confused or under a stressful situation, many mistakes can be made. They just can be made. And I'm not sure people really realize how many medications they're taking. It's like, oh yes, in addition to my 3 glasses of wine a day, you know, I'm taking something for a decongestant. And those things can have a serious impact, even over-the-counter medications.
Absolutely. Over-the-counter medications, just because they're available without a prescription, doesn't mean they're 100% safe to take any way you want to.
Right.
You have to keep in mind that many of the drugs that are over-the-counter today were recently prescription only. They just became half dose and over-the-counter, and they're still just almost as effective as they were when they were prescription.
Wow.
That's something to consider. I wanted to add one comment.
Please.
I'm sorry, follow up on what you were saying before.
No, please. This is why we do this show.
You know, Dan Bunditz, I don't know if you know Dr. Bunditz over at the CDC, but he is in charge of medication safety. He published a great article a year ago on medication-related emergency room visits in the United States. What he found was that there were 3 medications that were causing at least 30% of the problem. Warfarin, an anticoagulant, insulin, and a drug called digoxin.
Digoxin?
Digoxin.
Okay.
Now, it isn't so much that these were critical drug interactions. It was that these drugs had to be given at a critical dose. Otherwise, they cause major side effects.
Wow. Now, let's list them again for our audience.
Warfarin is an anticoagulant, sort of a blood thinner. Insulin for diabetes. And the last one was digoxin. It was really warfarin and insulin that were
And they
the most
were
common.
accounting for 30% of emergency room visits due to medication.
Absolutely. Just going to highlight how critical it is that you have to take these medications exactly as they're prescribed.
Well, providing warnings to people is really part of the mission of this show. I know we've just recently done a show about fall protection. And of course, drugs and their effect on us impacts on falls. People just don't seem to remember, if they're not part of the drug culture of the 60s, if they're pre the 60s, they don't seem to understand that drugs can materially affect your physical abilities.
Fall is probably one of the biggest areas, both in terms of frequency and significance downstream. It's been estimated that 30% of hospital admissions for people 65 and older are due to falls. And a large proportion of those, 10 to 15%, are due to medications.
And it's easy to see why. We're not talking, these are potent medications in many cases, especially if there's some underlying serious illness. I know as a caregiver, it was intimidating to me, particularly at latter stages of my mother-in-law's illness, for someone to hand me liquid morphine and say, now in cases of need, just a few drops at a time, I'm going, wait a minute, wait, how do I make that call? What, tell me what signs, what if she's just taken her latest pain pill? What? It can actually be frightening for a caregiver because there are multiple medications.
And you can add to that the fact that most seniors see multiple physicians, specialists of all types, an internal medicine physician, and the communication back and forth between physicians and our current healthcare system is extremely poor.
I understand. You know, one of the things I appreciated, and I told you this in the green room, was the actual intervention of a young pharmacist at our local facility who said, "Excuse me, Mr. Peterson, do you know what this is all about here? Because there are some contraindications on my screen." And I thought, well, bless you, child. She was warning me that there was something amiss here. Now, you actually do research in this area, right, and try to provide this information? How do you go about that? Is this a program that pharmacists learn and then bring with them to the job?
Well, certainly the education is part of it. We do have a significant portion of our curriculum throughout all 4 years that addresses geriatrics.
Mm-hmm.
We have a joint program in gerontology with the School of Gerontology. So we're working very hard to prepare our students. A large number of our students who go out in their clerkships during their final year of pharmacy school work with older adults. So we are trying to prepare them for this, and we're encouraging them to be where the decisions are made. Because if you go to a community pharmacy to pick up a prescription, that prescription has already been written. The pharmacist doesn't have all of the information available in the medical record,
right.
So is less well equipped in many cases to make a sound intervention. Whereas if the pharmacist is working more closely with physicians and other healthcare providers, they can perhaps make that recommendation before the prescription gets written.
Now, what about home visits? Because many times there are environmental issues in the home that just argue against proper medical management and medicine management. Are you teaching your students to get out there?
Yeah, we've actually done home visits, and let's acknowledge that they aren't the most cost-effective way to take care of patients.
No, of course
but
not.
if you consider the impact of some of these visits on reducing hospitalizations and ER admissions, it can be quite effective.
Right. Prevention.
Yeah, exactly.
Prevention beats the cure.
Absolutely. I have a horrid story to tell you.
Sure,
It's just
I'm ready.
incredible. We did a home visit on a patient because he was a diabetic and just wasn't getting anywhere near his treatment goal despite what the physician was trying to do. So he got referred to our pharmacy team. We looked at everything and said, everything looks correct. We can't figure out what's going on either. Let's do a home visit. Let's see what you're doing with your medicines at home. We get to this patient's home. I couldn't find the building. I went next door to the auto shop. They said, yeah, it's right over there. So take me over to this boarded up empty lot, pushes a board aside. There's a camper shell right in the lot where this patient's living. So we said to him, we gave you extra insulin. Where did you put this insulin we gave you for the next month and so on? Oh, it's in the refrigerator. In the middle of a lot is a refrigerator with no door, and there's the insulin bottle inside there. So it just goes to show you never know what's going on at home and how it may impact the patient's therapy.
Wow, that's really something. Well, of course, we have a very large population of homeless folks. We have a growing population of seniors. And USC really is renowned for servicing the community because it is in South Central Los Angeles. Right. So that's got to be a challenge as well, to have these people, walk-ins, if you will.
Absolutely. We have our clinics that we work with closely with the School of Pharmacy are all located near our campuses, either the main campus or the Health Sciences campus. We have the majority of patients uninsured or homeless. And it's really been a pleasure working with this population. To be honest, these patients are people that had jobs like you and I not too long ago.
Isn't that something?
It really reminds me of how humble I should be and thankful for my own work.
A lot of people are just 2 paychecks away from finding themselves in a real situation of need, and USC is to be commended because it's got the best outreach program I've ever seen. I travel quite a bit. Now, it's time for a short break, and when we return, we will continue our discussion of geriatric pharmacy practices, so please stay tuned. We'll be right back.
Emergency preparedness is everyone's responsibility. However, for people with disabilities, it's especially critical that we take the necessary steps to ensure our survivability. For additional information, please contact the Department on Disability or the Emergency Management Department by calling the numbers on the screen or by dialing 311.
Before approaching an intersection, so that's why 2 wrong turns don't make a right turn. Now let's learn about tailgating.
Hey, that's how I got my ticket.
You got a ticket for tailgating? That's not good.
That can be really annoying.
Doesn't get you there any faster.
It leaves you no distance to brake.
Which makes it easier to get into a crash.
And it also may increase your insurance premium.
And I hate tailgaters.
Tailgating causes crashes. Back off. Watch the road.
Welcome back to Aging in LA. Our topic today is geriatric pharmacy practices. Our guests, who are members of the USC School of Pharmacy, are Dr. Bradley Williams and Dr. Stephen Chen. Gentlemen, again, thank you for joining us. I think it's important for our audience to know just how complicated the world, the pharmacological world has become. What sort of education are today's pharmacists receiving? If you could go through that, please.
The majority, if not all, of our students coming in now have at least a bachelor's degree. Yes. And the pharmacy curriculum is 4 years.
Wow.
Much of it does include basic sciences, which is needed for the chemistry, the biology, genetics, principles of drug therapy, how drugs work, how the body affects drugs. They spend a good portion of their time, almost roughly half of their second and third years, focusing just on therapeutics, how one recognizes and manages problems with drug therapy. And the fourth year is spent entirely on clerkship, so they're out in patient care sites. Although they do have patient care experiences also during their first 3 years.
Wow. That is phenomenal. Well, here's the essential question, speaking as a boomer with a big generation coming online. Are we going to have enough pharmacists in the future?
If you look at the projections, no. Very simply. The Institute of Medicine earlier this year issued a report saying that there is a shortage across all health professionals to meet the needs of the aging population. And in 2002, the Institute of Medicine also issued a report on adverse drug reactions and medication problems, saying that the pharmacist was an integral portion of recognizing and preventing medication problems, that they needed to be there. So we see that no, as things stand now, we're not going to have enough.
Well, I didn't realize that there's an additional 4 years of education on top of getting your bachelor's, so this is a significant investment. So as a career choice, though, this certainly is going to be steady work. If you can graduate with this degree, the problems aren't going to go away.
Absolutely.
Absolutely.
Stephen, let's talk a little bit about something I know people are concerned with, both caregivers and the patients, the problems of addiction. Some of these medications our seniors take definitely have you could become addicted to them quite easily. So how would a pharmacist know that something excessive is going on?
Well, I think the benefit of a person using one pharmacy is that even if you're seeing multiple physicians, you go into one place and someone is monitoring your use of medications. Mm-hmm. So that pharmacy has the capability to look in their computerized medication profiles and identify that, hey, this person is getting this potentially addictive medication from this doctor and then this one as well. They're trying to sort of film at the same time. So as early as possible, pharmacists have an opportunity to contact these physicians and say, did you each know that each other is prescribing a similar medication? And what do you guys want to do about that? Do you want to just have one of you manage this or the other? Again, pharmacists are helpful in that regard, in that they're the only healthcare team member that has all that medication information.
Isn't that, this is very much like pilots and co-pilots, how the transportation department discovered that co-pilots were taking an inferior position when they wanted to speak up, and of course the culture said, no, don't ever question the captain. But we're getting better now. Every member of the team should speak up, and I'm including the caregiver. Because mistakes can be made. Doggone it, mistakes can be made.
Absolutely.
Yeah.
And pharmacists, again, we already highlighted the kind of training we get in drug therapy. I run a course where for a whole semester I'm teaching students how to identify literature that will convince physicians that there's a better option.
Wow.
And on top of that, how do you approach a physician that established for years and tell them that, hey, there actually is a better treatment option. So you're right. I think pharmacists are recognized more and more as having a great expertise in drug therapy, a great expertise in looking at studies, literature on drug therapy, be able to say this is a good study or this is not, and this is why, and that gets respect from physicians.
And well, it should. I mean, we all have to be open to new knowledge and best practices.
Absolutely.
We need to have that. Now, I want to brag a little bit about USC. This School of Pharmacy is one of the first in the nation, isn't that correct?
One of the earlier schools that founded in 1905.
Yeah, well, look at that. We're already past 100
right.
years. Oh, boy. Because the growth has been remarkable. And I don't ever really focus on the athletics because that we understand. But it's how important this school has become in this study of pharmacy.
Well, the schools, I'm sorry.
Yes, no, please.
The school's been a pioneer in developing clinical programs, moving away from the stereotypical pharmacist just counting medications and just providing information about how to take the pills, but actually developing clinical programs where, as you were saying, having face-to-face dealings with patients, being able to evaluate them and identifying drug therapy problems and getting those resolved.
Well, but there's a large research component to the USC School of Pharmacy, right? I mean, we've got scientists in there with their visors on. And wait, is there a particular focus at the USC School of Pharmacy? I've heard mentioned nerve regeneration, for example. Wonderful.
There are several pathways, several foci, but I think some of our strengths include research into neurodegenerative diseases, Alzheimer's disease, Parkinson's disease, cardiovascular disease, heart disease, as well as the effect of certain biochemical mechanisms in the body on the aging process. It's one of the areas where we have very good programs, and we have the opportunity to build on the knowledge that the basic scientists have developed and move it out to patients at the bedside. So the translational aspect from bench to bedside.
And that's very important because it can be often much too lengthy a process. I mean, I'm all for safety and care and all the rest, but gosh, if you've got something that's effective, it needs to get into the hands of the patients. Just go ahead. No, speak up.
Yeah, the other branch of research that we haven't spoken too much about is the clinical practice research.
Yes.
Looking at what is the impact of a pharmacist when you put a pharmacist on a medical team? Do patients actually get better? Do diseases get better controlled?
Right.
And that's a big part of what our department does. The clinics that I work with, again, they're mostly safety net and uninsured. We've been able to show that when patients see a pharmacist in these sort of clinics versus clinics that have no pharmacist, their chances of having their diabetes controlled, their blood pressure controlled, their cholesterol controlled are tremendously higher and significantly higher than otherwise.
That's great. You know, I was astonished when Dr. Robert Butler was on the show. He informed me that many of the ailments of our senior population actually have their beginnings much younger in life. Absolutely. And he particularly stressed this overwhelming obesity epidemic Americans are going through. Is there research into something, as I want to say, mundane, because, gosh, you would think weight control is something we ought to have a handle on.
You know, there's a lot of research going on in the area. I think, the biggest focus for that that seemed to show the best results is really diet and exercise, if you will. And, the pharmacist, I think, has to play a role in that because the pharmacist can serve as someone who can encourage people. And also, by managing their medications, can identify those medicines that may have, say, an adverse effect on their weight or limit their ability to exercise. And again, it's one of those things that needs to constantly be reinforced.
Well, I know that I love it in our local pharmacies that there is a packet of brochures immediately available. Blood pressure site where you can sit down and in that minute there's a place you put your finger in for heart rate. Why not? They're coming into you anyway.
That is true, but the pharmacists that I train specifically have advanced skills in providing primary care management, and that means that all those are useful things. I think it's really important to get sitting down face to face with the patient, identifying why it is that this patient can't get to control their disease state and addressing everything, including weight. And so we do have, as Brad said, we do have an impact on weight.
Well, one of the things I wanted to show, you brought along a chart that is a very helpful way to at least collate the information of medicines that you're taking.
Right.
And I know the printing is very small, but there's one column I want our audience to focus on. This here. The purpose of the medications that you're taking.
Right, and this chart, as simple as it seems, we give it to patients who struggle with taking their medications. They put it on the refrigerator at home, and they get it. They look at it every day. They start to learn about their medications, and you're right. This column here is in layman terms what it is this patient is taking this medication for. And they get it. Down the line, no matter what level of education the patient has, they eventually understand and are better at taking their medications.
Well, and all of these aids are important. I love the new pill dispensers. I like the fact that people are saying, look, this is important at this time of day. There's a reason. Now, unfortunately, our time is up for today's discussion of geriatric pharmacy practices. You got to come back. Thanks to our guests from the USC School of Pharmacy, Dr. Bradley Williams and Dr. Stephen Chen. And now, again, it's time for Senior Stat Shots. And once again, we found today's statistics in the recently released LA County Seniors Count, a survey of the older adult population in Los Angeles City and County. Remember, 16,000 people responded to this. Appropriately, today's statistics pertain to seniors and prescription medications. Seniors encounter the following problems regarding prescription medicine. 14% of the seniors in LA County have trouble paying for prescriptions. 6% have problems having prescriptions refilled. 5% do not understand doctor's orders. And 8% of LA County seniors have trouble taking their pills on time. The good news, 62% of our citizens over 65 experience no problems in dealing with prescription medications. And that's today's Senior Stat Shot. And you can get your own copy of this fact-filled survey by going online to www.ladcss.org, which is Los Angeles County Community and Senior Services. Click on LA County Seniors Count, and the full report will then come up. Or you can have a hard copy sent to you by calling area code 213-738-2065. That's 213-738-2065. The Los Angeles Department of Aging produces this program with CityView, Channel 35, so that seniors living in Los Angeles and surrounding communities are well informed on the many issues that face them in everyday life. And also to let you know of the many services that the Department of Aging offers our senior citizens. Now, we'd like to hear from you with comments on the program, what you like, what you think can be improved, and your ideas for future programs. Please give us a call. The number's there on your screen, area code 213-252-4088. That's 213-252-4088. Call us with your comments and ideas. We look forward to hearing from you. I'm Paul Peterson, and for the Los Angeles Department of Aging, the people here at CityView, Channel 35, and all of our guests on Aging in LA, thank you so much for watching. We'll see you the next time.